Hello and welcome to Regina's Corner. My name is Regina Marks and our discussion today is on hypertension. Our special guest today is our daughter, Leslie Marks, family nurse practitioner, board certified. Leslie, please tell us about hypertension.
Okay, well, thank you for having me today.
You're welcome.
Hypertension, let's talk about blood pressure.
Okay.
Blood pressure has to do with the amount or the force of blood flow through the arteries. And it also has to do with the force or rate of the contraction of the heartbeat and of the heart itself and how that blood flows through the diameter of the blood vessels.
Okay.
Persons who may come in to the office with a blood pressure of 140/90 or above is considered hypertensive at that time.
Okay.
But that doesn't necessarily mean that they have hypertension.
Right. Can I interrupt you
Absolutely.
for a minute? Yeah.
Yes.
I guess I could do that because I'm mom. Now, sometimes is that because of the white coat? What do they call it?
Yes, so there is a definition that's called white coat syndrome,
Okay.
where individuals may have a natural response in the presence
Okay.
of a medical facility versus whether it's a hospital or doctor's office,
Okay.
and their blood pressure will naturally go up
Okay.
or naturally will increase.
Okay.
Now, that's something that can be monitored not just in office blood pressure management, but also at home,
Okay.
monitoring those.
Okay.
So with hypertension, the office provider will monitor your blood pressure over a consecutive period of times. Now, you are considered to be hypertensive or have hypertension as a diagnosis if your blood pressure has a documented measurement of 140/90 on 2 to 3 or more consecutive visits.
Okay. Wow. Okay. So when someone is in the office now, they have that documentation.
Yes.
It's been 3 times. Where do we go from there?
From there, initially, the provider will begin what's called lifestyle changes, and that has to do with diet, exercise, smoking cessation, alcohol intake, stress.
Okay.
Yes.
Wow.
And when it comes to dietary changes, it's all of the good stuff, all the things that you like to eat.
Fried chicken.
So that would include fried foods, because you want to monitor your cholesterol
Okay.
levels. So foods you need to be incorporated into your meals with low cholesterol.
Okay.
Also low salt, low fat in your diet. Exercise. 3 to 4 times a week, you need to exercise for at least 40 minutes of vigorous exercise. And sometimes it's those lifestyle changes alone that can improve blood pressure. Smoking cessation, you've got to quit. Smoke increases your smoking cigarettes or other forms of smoking habits can increase your blood pressure, and so can alcohol intake.
Wow. Now, does it affect a certain population?
It does. There is a large percentage of African Americans that can have the diagnosis of hypertension. It does affect males more so than females. Some African American males are the highest population that is at risk. Not that blood pressure cannot be affected by any race, but the African American community, especially males, have a higher risk of hypertension.
Okay. Is there any other population?
Yes, whites can be affected, of course, or Caucasians, Hispanic population as well.
Okay. Wow. Okay. Now we have our diagnosis, and let's say your patients come in with that, and now you're treating them. What type of medications and what are the risk factors?
Well,
those
it
medications?
depends. Medication management will depend upon age. It also
Okay.
depends upon whether someone is a diabetic or whether someone has
Okay.
kidney failure, whether
Okay.
someone's black or white or Caucasian. Those different categories will determine where do we begin as far as your treatment. And the
Okay.
provider would discuss with that patient those options.
Okay. Can it turn around? I mean, if we have hypertension, can we? Can it turn around?
Hypertension is a diagnosis that can be long-term. However, can it be managed? Yes, it
Okay.
can. Sometimes it's manageable with lifestyle changes alone, and then there's other times where you do need medication for it.
Okay. Wow, what are the risk factors? And I may have said that before. Someone does have hypertension, and let's say that what are some signs that person can look for? Let's say if they're haven't been compliant to the doctor's office, but they're having
Sure.
symptoms, what could those be?
Sure. Most of the time with hypertension, it's usually what we call asymptomatic or no symptoms at all.
Okay.
Someone may not necessarily know. However, it's at-risk populations that need to be monitored more.
Okay.
And this was something that I did not mention that I'm glad that you asked that question because it reminded me weight loss. Weight loss is huge. So patients that are at risk are those who have high BMIs or body mass index, those that are considered obesity.
Yeah.
Also, of course, like I said, the African American community is going to be more at risk. Those who smoke, are the ones at risk, and they might not necessarily have symptoms. However, there are vague symptoms out there, such as headaches, chest pain, dizziness. I don't feel good. And you come in and you're like, whoa, their blood pressure is 190 over 100. What do we do? You know? So,
Wowee. Now, what else can hypertension, if it's not monitored, taken care of, what can happen? What are those risk factors?
So over time, at the beginning, I talked about blood pressure and what that definition is. It measures the force or the rate of the heartbeat and the flow through the blood vessel walls. So if your blood pressure is higher, that's going to be harder on your blood vessels. Harder for your blood vessels to push blood flow through. Now, over time, that can lead to other lifelong illnesses or other disease processes, such as kidney failure, such as stroke, such as heart attack.
Okay. So if we have any of those symptoms, if someone has those symptoms, they need to get to the doctor.
Absolutely. And most providers, if you are, let's say you are a diabetic, or you have high cholesterol, your provider may add medication that you may not understand. So it's good to ask questions. They may add on, let's give them, a statin or something to help their cholesterol as a preventative. Let's start them on a little bit of a blood pressure pill to protect their kidneys as a preventative.
Okay.
Sure.
Okay. So it's good to ask questions?
Yes.
It's good also for the provider to explain to the patient?
Absolutely. Especially when it comes to side effects of medications. And I have found even in my own practice that, it's good to be able to explain to the patient why they're taking the medicine, the side effects. People will most likely be more reliable to be able to take their medications if they understand why they're taking them.
Absolutely.
And explain risk factors too, and explain, what are the chances that I may experience this particular side effect.
Okay. Wow, thank you. Is there anything else that you want to, tell our audience out there, or anything that I may be forgetting to even ask you?
Sure.
So,
one of the important takeaway, tips with this is that hypertension can be managed, and it is something that is preventable. Something that you can actually start managing it now, prior to even being diagnosed, with that particular disease process. And then always, always, always follow up with your provider when it comes to your blood pressure. If you're noticing trends at home that, hey, my blood pressure is a little bit higher than what it has been, communicate that with your provider. Or if you've started a new medicine, or even if you've been on a medication for a while and you're starting to experience side effects, hey, I'm starting to feel dizzy all of a sudden, or hey, my ankles are swelling more than usual, or, I have this cough that, I just can't shake. I think it's related to my medicine. Let your doctor know about those side effects, because it could be the medication itself, or it may be related to something completely different. But definitely check in your blood pressure at home, making sure that you're checking it at the same time every day with the right cuff size. And then also, if you take it during meal times, what are you eating during that time?
Yeah.
Because that can affect your blood pressure.
Okay.
Yes.
Or there are some other places. What if someone doesn't have a cuff, can't afford to get a blood pressure cuff? Where else can they go prior to their provider's office?
Most pharmacies have options, and also malls have options with an automated blood pressure machine there that you can check, and you can check that. Like I said, at CVS, Walgreens has it, I believe. Maybe even Kroger. I'm not 100% sure on that.
Okay.
But it's places like those that I mentioned, and then, like I said, there are some places in the malls that have it as well.
Yeah, I'm noticing that there's a lot of your drugstores that have like the little mini clinics in there.
Yes.
And just outside the pharmacy.
Yes.
That you can be able to check your blood pressure.
Yes.
So, okay.
Yes.
And so a normal rate for, is it different for a woman and a man, their blood pressure?
Typically not Not necessarily, unless if you have to think about all of everything. Think about it in a big picture of actually what's going on.
Okay.
You know, because blood pressure, for example, in women, if you're pregnant, your blood pressure is going to be a little bit different.
Okay, absolutely.
And it's managed different
Yeah.
too if your blood pressure is elevated during pregnancy.
Yeah.
But, you know, your typical blood pressure, and it depends on body size and type.
Absolutely.
You know, anything, it should be, again, less than 140/90.
Okay.
A smaller individual's blood pressure may not be as high versus someone that's, you know, of greater size.
Yeah, and I know mine's run low, my diastolic number, which is your top number, right?
No, your diastolic is your bottom number.
Systolic number
Systolic
is top.
is your top number.
I was trying to sound like I was smart. Diastolic is my lower number,
Yes.
right? Okay. I know that both of those run low, but that's kind of normal for me. So someone else's, they would have to know what their blood pressure is for them
Yes.
normally?
Yes.
Okay.
Yes.
All right. Well, in closing, yay, thank you so much. Is
You're
there anything
welcome.
else you want to tell our audience before we say goodbye? Or
I don't think so, other than just make sure that you, and it's, you know, when you do see your provider, whether it's a physician assistant, nurse practitioner, internist, ask what your blood pressure is and write it down so that you know what your numbers are.
Yeah.
And definitely promote wellness visits. That's a perfect opportunity for hypertension screenings. You know, it should be screened at every visit, but
Absolutely.
that's the perfect time to get it taken care of. So.
I just want to add too, so make sure that you're being honest about everything with your provider, because it's better to get treatment now or to find out what's going on instead of later on. And then, you know, you have such this big, huge thing to try to manage. So be honest with your provider and take good care of yourself. God wants us whole. He wants us healthy, mind, body, soul, and spirit. Don't forget to subscribe and hit like and hit the bell. Thank you. We'll see you next time.